Okay, hello everyone, and welcome to this webinar on digital health solutions for adolescent boys and young men, organized by JSI. My name is Otim Oscar. I am a I am a youth supporter at Lira Regional Referral Hospital, as well as a young adolescent peer supporter that is supported by G2G USAID. Uh, this webinar is part of series called Healthier Futures with Adolescent Boys and Young Men, which explores how to close the gaps in preventing and treating HIV and related health challenges for adolescent boys and young men. The last webinar was on gender-based violence, and you can learn about the series in the chat section. Today, we'll be talking about integrated, differentiated service delivery models for adolescent boys and young men. But before we dive deep into the heart of the matter, I want to remind you of a few things. Number one, because of the volume of the participants, we have decided to mute you so that we have an audience in the webinar. And secondly, please select your language interpretation channel in English or in French, such that you can have the best language you understand better. And there will be time for questions and answers at the end. So please feel free to put your comments or questions in the chat section. And immediately after the webinar, we shall have a 1 hour long workshop that will be after the webinar. So please, if you are RSVP'd to stay in, please do. Today, we want to spotlight opportunities to better engage and serve adolescent boys and young men. And why are we talking about this though? Our first panelist will provide an outline to the evidence base supporting the need for the global HIV response to better work with men and boys. But before we dive into that, I would like to provide you with my own perspective. You see, adolescent boys and young men do face a lot of challenges as they transition from adolescence to adulthood, and some of these challenges can be physical changes such as puberty, sexual health concerns, or even a lot of challenges as they navigate through the societal expectation. So as a result of this, you'll find that we as boys, we are exposed to different health risks compared to our female counterparts. And for that matter, it calls for a specific procedure or a service delivery that addresses our need and our interest while looking at our uniqueness. And when we talk about societal expectation, I don't want to understate the social norms and the tradition, but you find out that around the world, you find that tradition norms always state health-seeking behaviors to be quite a site of a weakness among us men. So it is always stated that be a man, and there are some other things that you don't have to look for because you are the man. But at the end of the day, we are human, and we need all these services. And if you don't get them, obviously you'll be back down. And societal expectations. If we are to have a tailored health service that will provide our young men, it needs to address such a matter. And it is not only about that, but also access to the services. Just like just like right now, I'm from school. We had our examination, the national papers. Before we started the examinations, we had a briefing. And that briefing involved an health education about HIV and AIDS. And it was done by the school nurse. And during the session, I found out that most of my friends didn't know so much about some of the preventive measures, especially when it came to PEP and PrEP. They didn't know anything about that. All they knew it was you have to condomize and be faithful. And such a barrier will, just because they lack awareness, they will not find time and look for that service. So if we are to have a service delivery that is catering for only adolescent boys and young men, it should be catering, it should also involve that awareness, such that where they know that we have these services. My friends at school don't know that PrEP is there, PEP is there, but these things are there at the health facilities for free, and you don't have to pay any money to get them. But they don't know, so they won't go for it at all. And if you are to have a tailored service delivery for adolescent boys and young men, it shouldn't only aim at treating illness. It should also aim at boosting self-esteem, at building young men that can that can look for services on their own, that can be confident to approach health facilities and get these services. Mm. And that was my perspective. And with that in mind, I would like to welcome our first panelist, Wole Ameyan. Wole is a technical focal point for on the VMMC, men and HIV, and they work at the World Health Organization headquarters in Geneva, Switzerland. And working across prevention and treatment scopes of work, and he is trained as a medical doctor, and with a specialty in international public health. He has 15 years of progressive clinical and programming experience with government ministries, international government organizations, NGOs, and quite a number of communities. Wole focus on policy and program areas to support the delivery of evidence-based service delivery interventions through country-owned and sustainable health systems. So, Mr. Wole, can you tell me, what does the global evidence say about the status of the HIV epidemic among adolescent boys and young men? And why should we be focusing on efforts on services for this demographic?
Yes, so thank you so much, Oscar. And let me just begin by saying that you have given a really a very nice context, when you spoke about your perspectives to this population. And I think what is important as well is that it was personal as well. You've been able to bring out some very personal nuggets on how it feels to be an adolescent boy and young man, but also how that needs to be considered in how we tailor services for this very unique population. So in my in probably a few minutes, I think I have between 8 to 10 minutes. I will be, like you said, Oscar, I will be trying to put forward a rationale as to why this unique population has to be focused on with tailored services, but perhaps to start with, that word as well, tailored services. Sometimes we have a generic meaning to it. If we're speaking to other populations like adolescent girls and young women, but even other populations, we speak about tailored services as services that we provide, uniquely for that population. But for adolescent boys and young men, it has to be a bit different. So it isn't just about services that you provide for the population because they're unique, but it's also about services that we provide towards that population because over time, and I'm sure many of you would agree, this population has been somewhat neglected in the general scheme of things, globally and even for public health. I think one of the first points I'll probably mention is what you said, quite well, Oscar, in terms of that unique phase, the unique developmental phase of adolescents and young adolescent boys and young men. So, like we know, I think one of the best ways that has been put forward on this is that this population, they're not simply older children or younger adults. It's more that this phase is quite unique because it is when there is this rapidly developing, physical, sexual, psychosocial, mental, hormonal. I mean, you can go on and on about how as this young boys develop into young men, they are going through this rapidly developing changes. And without, without putting into consideration the fact that this rapidly developmental change affects how they think, how they behave, how they fit into society, then we will be doing a lot of wrong if we decide to program for them or to provide services for them in a generic way. Certainly, those changes that they're going through has to be considered and has to be tailored in providing them with services. So I think that's the first point, but that's more general to all adolescents and young people. Now, the second point is a bit more specific. And again, Oscar, you touched on this, and this is about the environment in which adolescent boys and young men, live. It is an environment where the preponderance of gender norms, but also toxic masculinity, comes into play. I mean, you mentioned, boys or men not being able to be themselves. But I think we have to also understand that a lot of these norms are also forced upon, boys and men. I mean, we see it in families, but also we see it in schools and in the general society. These norms sort of make it, there's a narrative of generalization now that we have to be able to, we have to certainly consider this narrative of generalization on how, boys need to behave or young men need to behave without having that understanding and tailoring it into how we provide services. I think we'll be doing a lot of disservice, as well for boys and young men. A lot of the time, and Oscar, you and others, you probably will be able to say this. There is this, narrative that masculinity is toxic, but I think that's something that we need to sort of change. So there is masculinity, but there's toxic masculinity. The toxic masculinity is what I think we have to see how we tailor those in our services and make sure that boys and young men are able to be themselves without this, forced upon narratives and what I called, this narrative of generalization. Now, the third point is about the world that we live in today. So there is, of course, a competition for resources, right? So one of the biggest rationale is to see how we can frame this topic in terms of how it benefits society. In that, we know of what we call the triple dividend of focusing on adolescent boys and young men. And in WHO's a new framework on adolescent well-being, there is now a very clear rationale to understand that focusing on adolescent boys and young men is not just for now, but also the triple dividends in terms of how those benefits go into when they develop into adults, but also as they pass it on to other members of their society. I think the understanding that having just one service is not enough, I think is really important. So it's not just HIV, but it's also the general well-being of adolescents. So we know from data that smoking, for instance, alcohol, cannabis, but also other psychoactive substances, most of them are actually started during adolescence. So we know that 9 out of 10 adults, for instance, would have had their first cigarette at the age of 18. So that provides a rationale in terms of prevention, starting young and making sure that the services that we provide maybe later on, perhaps we need to rethink and begin to provide those services now. Now, there are three frameworks from WHO that, maybe I can't speak to them now, but I'll be happy to share them, afterwards, on the adolescent and young adult well-being framework, which speaks to not just HIV, but also other services. The global standards on quality, it's not just about providing the services, it's also about providing quality services. And then finally, there is a new men and HIV framework that speaks to adolescent boys as well, but also young men as they grow into adulthood, which focuses on 3 pillars on access, quality, and supportive services, which I am sure as we move forward to this conversation, we would be able to find the entry points, certainly, for instance, on digital interventions for adolescent boys and young men. I'm going to make one final point, and that is on making sure that as we move forward, we have a rights-based approach to engaging adolescent boys and young men. So it is not a token to bring in young boys, and I'm so happy that we have Oscar and other young people on the call, but we have to understand that the rights and responsibilities of engaging and meaningfully engaging young men in their programs is entrenched in UN charters to make sure that as we move forward, this understanding is really, really entrenched and making sure that our programs and our services engage young boys and have them right at the center of it. So I'm going to stop with that opener. But I'm happy to, of course, continue engaging and really excited to hear more from other panelists as well. Over to you, Oscar.
Oh, wow. Thank you very much, Wole. This is a great foundation as we kickstart off the conversation. So we know that something must be done, but next we need to turn this whole into action. Our next speaker will help us think of just that. Gabriel Mutua is a passionate and creative with 6 years of experience tackling global adolescent health and youth development issues, combining his skills on in journalism with expertise in communication for development and user-centered design. He designs and executes and measures the impact of impactful projects and campaigns. At HCDExchange and the initiative at JCI, Gabriel is the program analyst. He ensures efficient workflow and high productivity, while also tracking and supporting the seamless implementation and communication of project deliverables. So my question to you, Gabriel, is how do we still the global lessons into local solutions that meaningfully engage young people?
Thank you, Oscar, for that lovely introduction. I will answer that in shortly with a brief presentation that I have for us today. Maybe it can be pulled up. Thank you. Thank you. So next slide, please. Yes. So I'll start by introducing us to what HCD is, what the HCDExchange is. And the HCDExchange is a knowledge hub driving locally led human-centered design and public health in Africa and in Asia. We've been doing this by increasing access to and use of HCD resources, knowledge, expertise, and opportunities in public health programming. Next slide, please. Moving on, for those who are new to human-centered design or HCD, plainly put, it is a problem-solving approach that keeps human perspectives at the center. HCD includes a set of steps, tools, and mindsets that guide young program participants through a process to co-create a solution to a problem. The HCD process also considers other stakeholders and factors into consideration because these usually have a crucial impact on the success of any solution. Thinking about the people involved, contextual factors, and resource availability can help lead to sustainable interventions that will be well integrated in communities. Next slide, please. At the HCDExchange, we like to describe the HCD process using the double diamond approach. Now, this process is a cyclical journey comprised of 5 distinct stages. We begin with empathize, and here designers get to immerse themselves in the lives of young program participants, building rapport, and then gaining understanding, a deep understanding of the challenges they face within their specific context. Building on these insights, we move to define, and this stage involves synthesizing our observations to pinpoint the core challenge. It is very crucial that this challenge resonates directly with the lives of our young participants. Once the challenge is clear, we ideate potential solutions. This is a collaborative process where we involve both designers and the young program participants, as well as other key stakeholders. Together, here we brainstorm and explore a wide range of possibilities based on their specific contexts. With a clear direction, we transition to prototype. This phase involves creating tangible representations of our ideas, which we call prototypes. These prototypes are rough initial versions designed to be tested in real-world settings. And finally, we test and iterate. Our prototypes are shared with young program participants to gather valuable feedback. And at the end of the cycles of testing and iterating on the solution, it is either rolled out for a pilot or implementation. In some youth programs that we've been a part of and seen, young people have been integrated into the team as young researchers or designers. Research then gets to take a more peer-to-peer learning approach, and it becomes much less extractive, and the solutions get to be much more aligned with the lives of the young people. There is more information and resources about HCD on the HCDExchange website, and I'll encourage you in the course of the webinar to view the link that will be posted by my colleague, and also get to attend our master classes. There's one coming up on September, and stay tuned and check our socials and website. We will get to be posting the dates soon for you to learn more about it. Next slide, please. For the last few years, the HCDExchange has been focused on developing tools and frameworks that can help strengthen the human-centeredness of ASRH programs, along with effectively applying the human-centered design process to an ASRH program. These tools have been co-created with our community practitioners. which is made up of ASRH and public health professionals, and also designers who are under 25 and over 25 years of age. I'll be talking about two frameworks shortly that are relevant for HIV prevention programming and digital health solutions. Next slide, please. The first one is the quality and standards framework, which is a set of 8 principles, as you can see on the screen, with corresponding actionable steps, tips, and resources to guide the safe, equitable, and effective use of HCD in ASRH research and programming. It is based on the HCD process and specifically takes into account young people as program participants. Those implementing HCD in ASRH projects may select from the principles and implement them in their context. The framework itself provides tips and resources that will help program implementers apply them effectively across the program cycle. Because of time, I will also not go into detail about it, about the 8 principles which are on your screens, but the link will be shared in the chat by my colleagues in the course of the webinar. Next slide, please. The second tool is the Meaningful Youth Engagement 4-step journey. The creation of this tool was led by our Youth Leadership Hub at the HCDExchange. This tool includes 4 steps to engage young people meaningfully across all kinds of programs. We begin by engaging young people deeply. This involves identifying and overcoming barriers to participation, providing clear information, building their capacity for meaningful engagement, and collaboratively setting program expectations and goals. The next step is empathize. Here we get to prioritize understanding and address biases and power imbalances if they're there. Creating a safe and inclusive environment has shown to encourage open dialogue, and it provides ample opportunities for young people to showcase their skills. The next step is evaluate, which is essential for continuous improvement. We co-create indicators aligned with youth priorities and establish platforms for regular feedback. What is important to note is we ensure that that feedback is heard and acted upon. Finally, we extend our commitment by fulfilling promises and reporting back on progress. This ongoing process involves adapting to evolving youth priorities and seeking their input to guide future directions. Again, while I have provided a quick overview, a lot more details exist within the tool, and the link for this tool will be shared in the chat. Thank you for hearing me out, and I'll pass it over to Oscar.
Oh, wow, and thank you so much, Gabriel. That was really wonderful, and I really love that. And for those sticking around for the workshop afterwards, believe me, I am so very much looking forward to hearing your reflection on this approach that is so mind-blowing, and I love it so much. I would like to next welcome James Mwanza. James has worked closely with international NGOs and USAID funded projects and the Zambian Ministry of Health on HIV prevention and treatment initiatives. He is currently the Hub and Clinical Services Manager for the USAID Discover Health Project in Chingola, and which is implemented by JSI. At Discover Health, they develop innovative models for young people, like the triple case management and specialized case manager for the option B plus program, and designed on an online dashboard to improve retention. James also work on PrEP implementation for adolescent girls and young women, promoting voluntary medical male circumcision as well, and creating virtual health platforms and for the young people. That is so wonderful. And passionate about public health, James is committed to advancing care for vulnerable populations, especially adolescent and youth. My question to James is, given your 15 years of experience working in prevention and treatment, especially for adolescent boys, adolescent and youth actually, what do some of these solutions look like in real life?
Thank you very much, Oscar. That is a wonderful introduction, and thank you very much, listeners. The question that Oscar poses is a very, very interesting and very nice question, because it speaks to real life experiences that we are about to talk about, and something that comes from Discover. I really appreciate for the opportunity that we are here to listen to all of you, and we greet all of you. Discover, to start with, has been at the center of digital health initiatives, because we do understand, as you've heard from the preamble, from the WHO perspective, human-centered design perspective, that what is happening is we need to make sure that adolescent boys and young women, adolescent boys and young men are able to access quality services through models which are easy, through differentiated service delivery models. And this is exactly which we are talking about. In reality, JSI, through Discover Health project, has made various activities and have done tremendous work to just make sure that all the services or platforms are at the center. They promote person-centered care, particularly to adolescent boys and young men. So first and foremost, I would want us to have a feel by having a brief video that is going to guide us to just have an experience of what it looks like in one of those DSD models.
Sign up today, sign up today. Wemunandi sign up today, sign up today. Sign up, sign up, sign up. Sign up, sign up. Sign up, sign up, sign up. Sign up, sign up, sign up. Sign up, sign up, sign up. Healthy up. The healthy hub is here for you. So no joke tina mwe wana mtegenya. Uwete wa mipime. Oli la ino investoni. Iwe kwisa pye wako pima. Mwabai wa chipatala chenwicho. They are here for you. Chipatala chenwicho. Ni mwewa waetera. So no joke tina buladha wete waleza. Asisita wete ne waleza. Healthy hub. Chipatala chenu chibomfieni.
Hoza buyanda nzira munga kwatine ama truck driver, so sinangaina chance yokuthi niende inde pa clinic or pa any health center kutali pafupi, but atisa manage ukuthi ngibule pano ngidinga ama services yawo.
Sign up today, sign up today. Namutekenya sign up today.
It is our responsibility to redesign health services and support the health system to ensure that we address the barriers and meet men's needs so that they are eager to access health services, adopt healthy behaviors, and adhere to treatment if needed. So this is why initiatives such as Men on the Move are important. They bring high-quality services right to where men work, where they live, and where they socialize. To the markets, to the truck parks, to the borders such as this one here.
Thank you very much. So you can see with that video in itself, it speaks to itself. And I want to take this opportunity to just say, for those that might not understand the local language, there was Bemba being spoken within the video. And in that video, there was one man who particularly said, I am able to access a service where I am instead of me going to the clinic. That's a message that we are trying to send at Discover. That's a message we are trying to send as JSI, because we understand to say when we differentiate service, it promotes access. At the same time, you maintain quality, because within this particular platform, the Health Hub, we have qualified medical practitioners, we have qualified nurses, we have supportive counselors that make sure that people access service nearer to where they are. For the trackers, as you've seen, the trackers are there and they are just accessing the services where they are. When they click the code that they just talked about there is in Zambia, you click the code and then it takes you to the service. And the code is *573#. When you click to the code, you select a service of your choice. For example, if you want to access the Health Hub itself, which is the Men on the Move platform, if you want to access the Stealth Virtual Clinic, it will take you there. If you want to access a Youth Cloud Clinic, it will take you there. These platforms will now open you up to further services, and people, the moment you click to say you're requesting for a particular service, the providers, which I've talked about, they will come to you and they will offer a service nearer to where you are. These services, from the video, you can see to it is speaking to the people, particularly who are away from home. And these, we are talking about truck drivers. We do understand at JSI to say we have adolescent, particularly young men who are truck drivers, because I know that most of us, we enter into employment after the age of 20 going up. Sometimes people enter as early as 18, provided the law allows you to work, people can work as truck drivers. Discover, make sure to say they are able to access services even when they are not near the clinic. Because if they are near the clinic, it will be easy for them to go. However, they can't leave their truck because they're scared of security. They can't leave their truck because they know to say, if we leave the truck here, anything can happen. I'll lose out. I'll be the one to be charged by the people where I'm coming from. Therefore, they come, they simply request a service through the Health Hub platform. And this is what we are doing for the adolescent boys and young men, because we want to make sure that access is completely zeroed, access is improved, and most of them have these particular services. We are not just talking about the digital health hub, we are also talking about the Stealth Virtual Clinic. We understand to the adolescent boys, as young men, they are in diverse populations, and would ask to say, if you need services that are tailored to key population, you will access them, and you access them through the Stealth Virtual Clinic, because this particular platform opens you up in an environment that is safe for you, in an environment which is non-discriminatory, in an environment that allows you to feel free and comfortable, and you choose to say, I'm able to be attended to in this particular location. And the code is awesome, because once you choose it, you have access for these particular services. As I stated, all you need is to simply, if you are in Zambia, this code is *573#. Then it will take you to the service of your choice. For the youths, we know to say, as you say, to say majority of the youths have various challenges to access services, because most of them, as adolescent men, they have responsibilities to take care of their families. Some of them, you find to say they start hustling at a tender age, and all those who are hustling, they might not find sufficient time to go to the clinic. We have heard so many times to say the health sector, men always present late at the health clinic, at the health facilities. This is why we are talking to say today we need more youths to access these services in a convenient way, something that is coming to them. And we are talking Youth Cloud Clinic. Even it's still the same platform. And this is why we are saying USAID Discover Health, JSI, particularly the people of Zambia, you are privileged to have access to these particular services because these services are around. And we know to say JSI across the globe, you are doing wonders to just make sure that you answer the call of making sure that adolescent boys and young men access services in the comfort of their homes. At the same time, these particular services are accessed when they do not have any impediments, no segregation at all. Thank you very much. I really appreciate, and I'll be available, as I just stated, to say going forward, we will understand to say, as we go towards the workshop, further understanding of what happens through these digital platforms can be understood further. Thank you very much.
Wow, that was so glamorous and it was just so perfect. I really liked the presentation. It was just so perfect, and thank you so much, James, for what is being done in Zambia. It is really great, and obviously, I would prefer that something like that also comes in to Uganda. That is really so wonderful. Now, as a I want to hear from another perspective. I'm so eager. I am happy to introduce Emmanuel Chola. Emmanuel is a dedicated and passionate youth just like me, and is a voluntary medical male circumcision mobilizer. He is committed to improving the health and well-being of the young people in his community. With a strong background in community engagement and outreach, he has successfully mobilized numerous youth to take control of their health through VMMC, contributing significantly to the prevention of HIV transmission and other health benefits. Through his tireless efforts, he has built trust and fostered partnership with local leaders, organizations, and stakeholders, ensuring the sustainability of VMMC programs and promoting a culture of health and wellness among young people. Emmanuel's strong communication skills and unwavering commitment to his work make him an exceptional mobilizer and a valuable asset to the virtual youth programs. Emmanuel, it sounds like you are doing a lot of great work mobilizing your community, and I would love to appreciate you really a lot for that. Can you tell me what role you think digital solutions play in better reaching adolescent boys and young men, and what are some of the considerations program designers and implementers should keep in their mind as they consider ways to better reach to this group of people?
Good afternoon, everyone, and thank you for the introduction. And once more, good afternoon, everyone, and thank you for according me the opportunity to discuss what digital platforms like the Youth Cloud Clinic, YCC, and how they have changed how we provide health services, especially for the adolescent boys and young men. So, YCC is basically an innovative digital platform that empowers us to so YCC is basically an innovative platform that empowers sorry for that. So YCC is YCC is basically an innovative digital platform that empowers adolescent boys and young men to take control of their healthy and well-being by simply signing up. So what I mean by simply signing up is this digital platform YCC is available to these youths, adolescent boys and young males through their phones. So they are able to digitally get linked to physical health services at the time and place that is best convenient for them. And as a result, it enables us to interact with young males and boys who are in a very who are in having busy schedules. For example, some like the previous video, men are unable to get services from the facilities because either they feel intimidated or they are unable to access these services physically because of their busy work schedules, as earlier stated. So it's very important and cardinal that we bring these services to these people at their comfort zone. As we all know, this is the 24th century and everything is digitalized, and us, by bringing YCC to the table, we are broadening our coverage areas and we are interacting with more clients than usually expected. So, as you may be aware, adolescent boys and young males may feel uncomfortable to visit the facility physically or visit physical health centers because they feel intimidated by the service providers. So YCC is there to give them the opportunity to access these services at their own free time and will. So it's very convenient for the clients to access services at their own time, and it's there's a lot of privacy there involved. Yeah, so as you may be aware, if adolescent boys and young males may feel hesitant or uncomfortable to visit a physical facility, perhaps due to concerns over confidentiality, or maybe they are simply not ready to discuss their health concerns in person. So the YCC provides a self and non-judgmental space for the issues to be addressed. Otherwise, whatever the reason for the YCC offers an alternative where they can ask sensitive questions without fear of judgment and connect with peers, counselors, and providers who understand their struggles. Another additional benefit is that the YCC also presents is that it broadens the coverage to find more men who may not be able to access it using conventional services, physically visitation to the clinics or facilities. So by leveraging on this digital platform, we can connect with hard to reach populations who normally don't have the time for the crucial health services and engage them. And the best part is we can meet their meet their needs in the most comfortable ways, whether at school, college, or other safe spaces. So by taking our services to them, we are reducing the barriers that discourage access by creating a more inclusive and supportive environment for them. So quite early, the YCC is helping us reach these difficult populations, but yet who are at high risk of infection, such as HIV and STIs. Also, that's something that would show, or probably already everyone knows, that adolescent boys and young males are getting more and more tech savvy, and each day that comes. So even the semi-considered rural areas like where I'm stationed and as such, the comfort of digital platform is growing day by day. So the Youth Cloud Clinic takes advantage of this and taps into this trend to provide a more natural and engaging space, not only to receive health information, but get linked to health services too. And as a matter of perspective, actually, some articles I read revealed that young people are more likely to open up and share their concerns online compared to traditional face-to-face interactions. So embracing digital platforms such as YCC can really be a game changer with regards to how health services are provided. So going forward, as we continue to innovate and develop new digital platforms for adolescent boys and young men, it is crucial that we continue to prioritize a client-centered approach. This means that if we continue putting the clients at the center or forefront of our design, maybe making process, it will go a long way ensuring that these platforms meet our concerns as we continue meet our concerns and needs, and empowering, relevant, but at the same time, easy for us to use. So lastly, but also very important, for us as adolescent boys and young males, is that as we continue to develop these digital platforms, two words should equally stand out, that it is very confidentiality and convenience. These are very crucial for this population group, and right, so that it will be to ensure that the digital tools are able to, one, safeguard personal information and promote privacy, while at the same time offer convenient access to services anytime and anywhere. So really, you will find that by prioritizing confidentiality and convenience, we can create a safe, supportive environment for adolescent boys and young males to engage in healthcare services. And really, this approach will enable us to develop, that's to relate with adolescent boys and young males, and help us to create a much brighter and healthier future for them. That is my submission. And once again, I thank you for this opportunity.
Oh, wow. Thank you so much, Emmanuel. That was insightful, especially when I hear about your program meeting the need for confidentiality among the young people. As you know, it is a big critical issue that needs to be confined before any service delivery is given out. And the fact that you're also bridging the gap of inaccessibility through digitalizing the program, it is really so wonderful. Now I've loved it so much, and believe me, I'm really so excited to hear from others during the workshop after the webinar. So please make sure that you stay in, and not forgetting, if you have any question, please drop them in the chat section, and they will be answered as soon as possible. And as we proceed, building from that, I would like to turn it now to Blessing Falade. Blessing is a program analyst with the biomedical prevention branch within the Office of HIV/AIDS and at USAID. Over the past 3 years as a program analyst, Blessing has supported the success of HIV biomedical prevention programs within various countries, specifically USAID's pre-exposure prophylaxis and voluntary male medical circumcision programs, the latter of which is a critical entry for men seeking HIV services. Before joining the biomedical prevention team, Blessing worked as an intern with the HIV testing services team at USAID. She obtained her kinesiology and sociology degrees from Rice University and Masters of Public Health from Emory University. Blessing is a relational and equitable centered leader with a mandate to advocate for health and wellness globally. When she's not working, you'll find Blessing enjoying a newly married life and investing in our local community, which is so wonderful. Blessing, can you tell us a bit about what you have seen as elements that contributed to successfully engaging adolescent boys and young men in intersecting HIV health programming?
Thank you so much, Oscar, for the introduction, and thanks for the platform and the privilege to speak here. I'm an institutional support contractor with USAID, and as Oscar mentioned, I support the PrEP and VMMC programs daily. And I wanted to take some time to speak specifically to VMMC because it is a critical entry point for adolescent boys and young men. There have been 32 million circumcisions globally since the inception of the VMMC program in 2007, with over 600,000 HIV infections averted. So it's a highly effective program. And about 80% of the circumcisions that happen globally actually happen between the 15 to 24 age range. So this program is highly important when we're talking about adolescent boys and young men. And it's specifically critical because it's not just an opportunity for HIV prevention, but men that come into VMMC clinics have access to what we call a minimum package of services. So when they come into clinics, they have STI screening, they are counseled by HIV counselors, they have HIV education, they have access to condoms, they are diagnosed and referred if they are a man that's living with HIV. So VMMC is a critical entry point for ABYM because it may be one of the few times in their life where they're having access to multiple services. Now, I know this webinar today is more specifically about digital platforms and digital solutions to health. And while we don't have any examples right now of VMMC being integrated into digital platforms, I wanted to speak to some other examples of how HIV prevention services have been integrated to the platforms. I'm really thankful that James actually spoke about Men on the Move, because Men on the Move is one of the innovative programs coming out of Zambia that I really admire because it's taking a target population of truck drivers. It's giving them convenient access, right, by QR code or putting in a number, and it's bringing services to them where they are. And so this kind of echoes a term at OHA, at the Office of HIV/AIDS, that is called precision prevention, which is making sure that we're reaching the right people at the right places with the right services at the right time. And so as we think about digital solutions for adolescent boys and young men, it's also important that we're ensuring that these services are precise in nature. Another example I wanted to highlight is coming out of Jamaica. There's a nonprofit there called Jazzle, and they have had tremendous success with reaching men who have sex with men specifically. And they've done this through their incredible online presence. They have a really engaging social media platform, and they have a late night talk show where they talk about PrEP, and their slogan is making PrEP sexy. And they've done an excellent job of pulling in specifically men who have sex with men through the way that they engage with them online. They actually have a website right now that's called My Health JA, where men can go online to get connected to various services such as STI testing, PrEP, HIV testing, of course. And then I also wanted to draw attention to EPIC. EPIC is a project that's funded by USAID and PEPFAR, and they have an initiative right now that's called Going Online, and they speak to the importance of digitizing health because it accelerates the progress of HIV programming. And so it's doing this for 4 main reasons, the reason why it's so important, which some of my co-panelists have already spoken to. 1, digital solutions reach a more inclusive and broad audience. 2, it provides differentiated services that are also client-centered, so giving adolescent boys and young men the privilege of choice. 3, it's highly efficient. And 4, and provides safe and confidential access to care. And so as we're thinking about digital platforms for adolescent boys and young men, it's important that we realize that there's so many benefits that are in store. One thing I wanted to bring attention to, I know Gabriel spent some time talking about why engaging with youth in the design of programs is important as we think about HCD and the quality of programs, but I will also argue that meaningful engagement with ABYM is important for building a sustainable state. And so the Office of HIV/AIDS is actually working on a sustainable reference guide for OUs right now. And one of the pillars that they're bringing out when it comes to youth is meaningfully engaging with youth. So when we're talking about digital platforms, are we making sure that ABYM are engaged in the design, in the delivery and the monitoring of services, whether this is through advisory councils, qualitative studies, boards? It's really important that this engagement is meaningful. And an example of this is actually coming out of Nigeria. There's a campaign called Generation Negative that was fully designed and even down to the name by a group of youth. So I encourage us to think about these examples as we're thinking about specifically taking a very successful program already that's reaching a lot of adolescent boys and young men, such as VMMC, and how to further its success by integrating it into digital platforms. Thank you so much.
Thank you so much, Blessing Falade. That was a great presentation, and I loved it so much. And in the meantime, I would like to bring back to, Gabriel. The HCDExchange provides technical assistance globally to help improve the meaningful engagement of adolescents and young people in programs designed to serve them, and the utilization of social and behavioral science to inform programs design and implementation. So based on the breadth of engagement that the HCDExchange has participated in, what kinds of interventions are you seeing work versus not work? And does it matter whether or not these interventions integrate HIV programs with primary or the other health areas?
Thank you for the question, Oscar. For me, mobile health applications and digital community platforms have been very instrumental in catering to individual needs. For instance, my Dawa in Kenya is an example of an online mobile health application that has been offering varied experience in the form of virtual doctor consultations and even with ordering and delivering of medication to be delivered at a place of a person's convenience. Also, when it comes to digital community platforms, the one that I've seen to be effective is the one-to-one platform managed by LVCT Health, an NGO in Kenya. The one-to-one platform offers a space to connect young people with healthcare providers and counselors who offer consultation and referral services to other providers that also offer youth-friendly services. In addition, the one-to-one platform also provides educational resources on HIV prevention, treatment, and care. I think with digital, I wouldn't say nothing is, some interventions are not working, but they're being made to be in a hybrid format, so a bit of technology elements are being harmonized together with what we would term to be traditional elements of differentiated care. And I do believe that it matters to integrate HIV with other topics like Wole mentioned in the beginning, particularly in reducing stigma and increasing access to care. For increasing access, integration will help open up awareness on prevention, testing and treatment services to a majority of people that would have otherwise not been reached because it won't be viewed as a standalone HIV program or intervention. In addition, including HIV with other global health discussions will help correct some of the misconceptions and fears that have largely been associated with HIV. Over to you, Oscar. Thank you.
Thank you very much, Gabriel, and for that feedback. So there's a lot to think about. Speaking of which, it is now time for us for the question and answer session. Please send any question you have specifically for our panelists into the chat section. And as a reminder, we will be closing up the question and answer session and transitioning to the breakup sessions for the workshop in a few minutes. So please make sure you drop your questions in the chat section, and definitely when we move into the workshops, we shall be talking about that all. And thank you very much for staying in and tuning in. It has been lovely. It has been a wonderful presentation from our panelists, and it has been so great for you to give us that audience and that here. And I know all these that have been said will be implemented, and any improvement that is required shall be worked on. And as we transition to the workshop, please endeavor to leave your questions in the chat section. Thank you very much.
Thank you so much, Oscar. It's been a really great webinar. So for the workshop, please click on the link that has been shared in the chat. If you're joining us for the workshop, please click on the link that has been shared in the chat, and we'll see you on the other side. So the link that has been shared by Sarah, please click on it, and we'll see you in the next.